All right, Kuwait, we do our weekly segment, of course, with ضمان. For those who don't know much about ضمان, I really recommend you to go and read about them online, because they do provide a lot of medical services for all the expat community and residents here in Kuwait. They have their clinics, and they have a different varieties of doctors and specialties as well, to be honest. Whether you're looking for some dietitian, whether you're looking for somebody who can take care of your teeth, or whatever problem that you have, it's a huge, big, major medical facility available here in Kuwait for all of you people. So I recommend you to go and read about them and look at the things that you can actually benefit from. Good morning to you, doctor.
Good morning.
Hi, how are you doing?
I'm doing fine. How are you?
I'm fine, I'm good. I would like to thank you very much for giving us some of your precious time to be with us here for this segment. At the beginning, Dr. Mehvish, can you tell us a little bit about you so the listeners would know more about yourself and your career as well?
Yes, sure. By the way, thank you for inviting me on your show. I am Dr. Mehvish Habib, and I've been working with DHAMAN for almost 2 years now as a general dentist.
Mashallah. Thank you very much, of course, for giving us some of your time, doctor. Now, the topic of the day is going to be the diet and its relation with dental caries. Now, I wanted to ask you, what is the relation between both of them, the diet and the dental caries?
Before answering that, I would like to first tell you a little bit about dental caries, which is also known as tooth decay or dental cavities, most commonly known as cavities or tooth decay. It is one of the world's most common health problems, more towards being a lifestyle disease, unfortunately. It's mostly common in children, teenagers, and older adults, but anyone who has teeth can get cavities. Now, what actually happens?
Yeah.
So you have your teeth, and then you have these bacteria in your mouth. And yes, the bacteria that cause cavities are already present in everyone's mouth.
All right.
So to this, you add sugar. Now, this sugar is what bacteria use for their energy, as their energy source, like for metabolism, reproduction, basically for their survival.
Yeah.
Now, the end product of this usage is acid. And this acid is what attacks the hard surface of your teeth, leading to damage. Now, if this damage is done repeatedly, it can cause cavities. Now, if you look at it as an equation, you have two constants. One is your teeth, and the other one is bacteria. They're already present. What is not a constant thing? That's your diet. The more sugar you have in your diet, the more chances the bacteria will get to produce acid. The more acid, the more damage to the teeth. So your diet is basically a very important factor in deciding whether you'll get cavities or not. But obviously, not all types of food are dangerous.
Yeah.
The food that have, that are highly processed and have a lot of refined carbohydrates are what we need to avoid the most. For example, you have your cakes, cookies, candies, sodas, ice cream, chips, and
sugary
so
stuff.
on. Other than having sugar, the thing most common in these foods is that they tend to be very sticky. Now, these foods are stuck to your teeth. They have lots of sugar. The bacteria is getting a lot of chance to produce a lot of acid, and this acid is getting a lot of chance to attack the hard surface of your teeth. If you keep on snacking and sipping sugary drinks constantly, it will give the bacteria lots of chance of producing acid. The acid will keep on attacking the tooth, and this will lead to a lot of dissolution of your hard surface of the teeth, hence leading to dental caries.
All right. So, doctor, what should we eat to avoid this kind of a problem? Do you recommend, of course, you talked about what we shouldn't eat. Now, what we should eat in general so we can stay a little bit away from this trouble?
Actually, it's not just what you eat. It's also when and how you eat that matters.
Yeah.
The best way of eating is eat in one sitting. Have healthy meals, eat in one go. Avoid snacking on sugary and sticky food and sipping sugary drinks constantly. Because if you do that, it will just, give a continual acid bath over the teeth, leading to more damage. Now, it's not like we can eliminate sugars completely, of course.
Yeah.
So what can be done if you really want to eat something, eat it in one go and clean your mouth afterwards. If you cannot, go brush your teeth, just gargle your mouth nicely so that whatever remnants are there, they can be flushed out. If you don't do that, obviously it will give ample of time for the bacteria to thrive, which we don't want.
Of course.
If we talk about being hungry in between meals. There are always healthy options, such as high fiber foods. These foods are not very sticky. For example, fresh fruits, apples, bananas, raw vegetables, carrots, you have cucumbers. They're very good and very healthy snacks.
Yeah.
Other than that, you can have cheese, yogurt, nuts. We have so many healthy, high fiber options. Now, the best part about these healthy options is they're high in fiber, which is good for your body.
Yeah.
They're low in sugar, which is again good for you. They don't tend to be sticky. And the best part, they keep the saliva flowing. It helps create a mineral defense against tooth decay. So it's like a win-win situation.
Interesting. So snacking on vegetables and fruit can help as well by, preventing the whole case to happen. Now, can you give us more tips on how can we prevent cavities as well?
Obviously, the first step, the foremost step is again avoiding snacking and sipping sugary drinks in between meals.
Which is hard to be honest, doctor.
Yes, but again, you always have healthy options to look after.
Absolutely.
Another tip, like the first and the foremost tip, which cannot be emphasized enough, would be to maintain a proper oral hygiene, which is, everybody knows, brush your teeth twice daily and floss at least once. Now, everybody knows to brush their teeth twice, but you need to brush for at least 2 minutes. And not just the parts of the teeth that are visible to the eye, but also the ones that are not visible, like the ones that are hidden behind your cheek, the ones that are your tongue is touching, which you cannot see. We need to clean all the areas. Also the top areas of the teeth, which which we use to chew our food, because that's where the food gets stuck the most. So brushing in the morning and brushing before going to sleep is very essential, along with obviously flossing at least once. Now, why we recommend flossing is because dental floss reaches the areas which
a brush can't.
Yes, exactly. Teeth brushes cannot. These areas are which areas? The areas which are between the teeth, where the teeth mostly come in contact. Now, if you do this regularly, you will not have any food remnants around your teeth. So when there is no remnant, the process, as I told you earlier, will not proceed. Okay, so my next tip would be to use fluoride toothpaste and fluoride mouthwash. Now, fluoride is a very well-known mineral.
Yeah.
It hardens the teeth to, helps it fight against cavities. Next would
fluoride.
Yes, fluoride. Next would be, as I said earlier, clean your mouth after eating, rinse it, or just flush it down with water. Somehow just keep your mouth clean once you're done eating, so that there are no food remnants. I'm emphasizing on this again and again, but this is what we need to make a habit.
Exactly.
My fifth tip would be to visit your dentist regularly. Now, it's not you visit your dentist only when you are in pain, but you should visit them regularly just for a general checkup to, catch a starting lesion, a starting dental caries, which can be treated there and then and avoided from proceeding towards a bad situation.
Now, doctor, when you say visit your dentist regularly, do you mean like the checkup every 6 months or maybe every 3 months?
Every 6 months is good enough. 3 months if you're more prone towards cavities. Obviously, when you go to your dentist on, say, every 6 months and you have a lot of cavities every 6 months, it's best to visit them every 3 months.
All right.
A small lesion is caught and treated there and then. Now, it's very good to consider dental sealants as soon as the adult teeth, the permanent teeth are erupting. And if you have a habit of visiting your dentist regularly, they'll obviously advise dental sealants. Now, these are protective coatings which are applied on the chewing surface, that is the top surfaces of the teeth. This coating seals the nooks and crannies on the teeth where the food tends to collect and get stuck the most.
Yeah.
Now, this will actually avoid food from getting stuck and cavities from starting from the top surface, which is the most prone side.
Exactly. Well, Dr. Mehvish, thank you very much for all the great and valuable information that you provided about taking care of our oral hygiene and teeth and the relationship between the diet and dental caries. Have a nice day.
You're welcome. Have a nice day too. Thanks.